And action! Barb had a question about sinus infections, and I wanted to kind of dovetail this onto my previous video about DrRic tutorial stuffy nose. There I explained about how eustachian tube dysfunction works, and it's about time I did a eustachian tube dysfunction number 2 video. But with this being the spring, I've had a lot of people in the last 4 weeks come in with ongoing issues of stuffy nose, postnasal drip, crackling of the ears, and I think it started back in the wintertime when we didn't have a winter. Essentially like 2 snowfalls and that's it, and nothing really died. So usually what happens is winter in Chicago kills most things. So you'll have weeds die, and then trees go into hibernation. And then they come out the other end when the water starts to fall with rain and sun shines and it starts to become warm outside. Well, that all started earlier, so a lot of people that were usually allergic this time of year, May, started to have symptoms sooner. And then that on top of the fact that there was probably a bacterial infection that started going around the Bartlett community. And it's kind of worked like a nuclear bomb, and it started to hit all the other neighboring townships. As far as whether it was started by a kid in a high school or somebody coming back from vacation, I don't know. But bottom line is that we had an infection that was not viral. Remember, viral infections usually go away in about 5 days. So anything that lasts more than your standard 5 days usually means that there's probably symptoms that are continuing into the 6th to 10th day from a bacteria. So if that's the case, the likelihood is observing and not doing anything will just get you worse, and you'll spread it to everybody. Now I don't like taking antibiotics, and I think my immune system is pretty decent because of the food I eat, the exercise I do, but I'm always going to be exposing myself to kids and patients that are sick in the office. And I usually don't mask up. I guess I'm bullheaded that way. I could challenge my immune system with an infection. So the idea would be that if there is a symptom that's persisting and possibly it's related to stuffy nose, painful ears, pus dripping down the back of the throat, sore throat, the need to do that all the time, then it could be an infection. If it is a sinus infection, and you'll see in my drawing, this is a face. It's supposed to be a head straight on. These 2 things will be the sinuses, the frontal sinuses. There's supposed to be sinuses here, maxillary sinuses, and 2 others back here, sphenoid and ethmoid. And there's some people that consider the mastoid air cells a sinus, but anyway. The 2 big ones are the frontals and the maxillaries. And if the frontals or the maxillaries are full of pus, they're supposed to... Listen, the reason we have sinuses is to decrease the weight of the head and skull. If this thing were all solid and encased the brain, we'd have a heavy skull and we'd probably have whiplash all the time. But to make the skull lighter, we have air pockets. These air pockets aren't just there without a drainage point. These air pockets drain. The air pockets of the frontals drain into right below that middle turbinate. These things are called shelves. They're turbinates in the nose. If you watch my video, DrRic tutorial, stuffy nose, you'll see what I'm talking about. I have a nicer illustration. The turbinates are supposed to be there as you take air in through a deep inhale through the nose. Air goes through, it goes through this way, and it gets hit by these turbinates, these shelves. And if air goes in and hits these turbinates, it warms the air as it goes down into the lungs. So it protects the lining and the throat. Also, the vocal cords are very delicate, so you want to have them protected. It also works as a siphon, and it filters bad crap, particulates that are in your air from getting into the delicate lung system. So the particulates trap, they're very tiny hairs, they line this nasal passage, and they trap stuff before it goes down into the lungs. These particulates also are based, the hair cells are based on the mucous membranes of the nose, and then the mucous membranes secrete mucus, thick or thin, but it goes out to the hair cells, traps whatever's on the hair cells, and then it drips down the back. Again, thus the reason why you have to clear your throat like that is because if you have a lot of particulates or pollution and you don't blow it out the front, and I really think dry blowing your nose, just blowing like that, hoping that the fluid comes out, is one way. Rinsing the nose with a neti pot and then blowing is a better way. I mean, how many times would you just paint this wall back here? If you just paint this and not clean off all the stuff in here, you'll just paint over the obstruction, you'll paint over the painting, you'll paint over the cross, you'll paint over the dust. What you want to do is get all the stuff off the wall, clean the wall of all the dust, and then paint and have a better coating. Well, same thing with the nose. If you spray Flonase or whatever spray you use, and you don't clean all the crap off of the nose, you're just spraying onto the crap. Whether it's a booger that's dried up, or dust mites, or dander, or allergens, you're just spraying stuff that's not getting on the lining. So clean out the nose twice a day with a neti pot. I mean, you can't overdose on a neti pot. It's just saline. And by the way, if you use an neti pot, you're supposed to use bottled water, not tap water, because of that amoeba sinusitis guy that died in Louisiana, according to the CDC. I think that was just one episode, but again, it points out that the water in Louisiana is probably nasty. If somebody got an amoeba infection through the sinuses, imagine what the kids are getting with drinking water from Public Works. Anyway, rinse out the nose before you use any nasal sprays. It will work better. And rinse out the nose on a daily basis twice a day anyway. Neti pot is usually suggested with bottled water. Sometimes I'll cowboy it if I'm out on a trail and I just went through a field of pollen or wheat. I'll have to clean out my nose and I'll just get some water from the tap. But Bartlett water or local surrounding water and forest preserves, nastiest water you can come across. But at least it gets all the crap out of my nose. So the way this works is that the sinuses here like to drain out. If the swelling to the turbinates is there, like I was getting to, then the hole that drains out the frontal sinus and this side, the maxillary sinus, into the middle turbinate, the hole will be blocked. If the hole is blocked because the turbinates, these finger-like projections, are edematous, swollen, and really boggy from years of allergies or irritation, smoking, tobacco, whatever it is, this hole will not drain out this frontal, the ethmoid, the sphenoid, or the maxillary sinuses, and you'll have a pounding feeling here. You have a pounding feeling in tooth pain or mouth pain here. You have a pounding feeling or a headache in the middle of the head. Or what's even worse, like I discussed in my DrRic tutorial stuffy nose eustachian tube video, this eustachian tube only has one way to drain out, and it's through the eustachian tube into the back of the mouth and the nose complex. If it can't drain through the eustachian tube, you'll have a pounding or an ear that sounds like it's crackling all the time. Some people will have tinnitus. So either way, whether you're having a blocked up nasal passage, turbinate swollen, there's a big booger in the way, or you're having the drainage is open, or the drainage port is open to that middle meatus or the ostium that goes through right underneath the middle turbinate, but the amount of discharge in the sinus or the amount of bacteria are outrunning the fluid emptying of the sinus. The sinus can drain out a little bit every day. Then depending on the position of the head, depending on lying down, you can drain out even faster. The problem would be if the sinus is producing way too much mucus. Remember, it's lined with living tissue, or it's got a fluid level of bacteria, then you're not going to be able to drain out fast enough until you open up the nasal passage, or you open up this hole, or you kill off the bacteria that are sitting in here, or here in the maxillaries. If you kill off the bacteria by exploding a bomb in here of antibiotic, you'll kill off the bacteria, you'll set the playing field straight, and hopefully the fluid will decrease, the swelling in the nose will decrease, and you'll be able to drain out and decompress, and you won't have that feeling of pain here, or the tooth pain, or the fullness to the sinuses here, the maxillaries. Sometimes all you'll have is just headache, blurred vision, eye pain, or just that pounding in addition to fever. If you're having all that stuff and you're having drainage, it could be a combination of both sinus infection of the frontal, sinus infection of the maxillary, or an ear infection plus allergies. So it's always difficult, especially in the spring, to figure out which came first, sinus infection or allergies or just trauma from the weather going from 40s one night to 70s the next day. Or maybe you just ran into somebody with a whole bunch of Lysol spray, like I sometimes have to walk into one of these rooms after somebody of a smoker leaves the room. We'll have to spray, and I just walk into this cloud of Lysol. It's like, oh man, I can just imagine some of the crap that I inhale. But I am bulletproof, I hope. And so anyway, these are some of the symptoms that you have to worry about. In calling anybody a sinus infection, you would expect a whole bunch of crap coming from the nostrils. You'd expect a whole bunch of post-nasal drip. You'd expect the pounding, but not everybody has it. In some cases, it's just crackling, and the time of year, and the fact that this community was sick, and I know because other people have come to see me. So even though somebody might say in the past they've swabbed your throat and it looks okay, ears look fine, it's always worth a second opinion if you have persistent symptoms. Sometimes getting that second opinion, like from another doctor or a specialist in ENT, otolaryngologist, ENT is ear, nose, and throat doctor, might be able to give you a nice idea, thinking outside the box about something else that could have been an issue or the cause of your suffering. And remember, whatever you do, if you kind of just foster an infection continuing, you can kind of muscle your way through a couple of days, maybe get by work, but you're also making everybody else infected. Yes, you are contagious. Sinus infections, ear infections are technically contagious. It's because of our immune system and our blockage that we get the infection, but because of that large body of bacteria that have cultured either here or here or inside the ear, you cough this up on somebody, you have an inordinate amount of bacteria that are existing somewhere around here, and the biggest way to give that to somebody else is to launch it in their direction. How do you do that? A cough or a sneeze. Or if I go like this and just say, hey, how you doing? Nice to meet you. You're going to be transferring bacteria. If that person happens to be immunocompromised or pregnant or a little kid or a baby, that's not cool. So, and not only that, if it's one of your relatives, you might get antibiotics. This person gets it. And as you finish your antibiotics, you get exposed. It comes back to you all the time. So it's nice to get everybody treated. And even if you don't use or like antibiotics, I have my concoction of herbals that I always rely on. I like red reishi mushroom. I like astragalus. I like quercetin. I like increasing fluids. I like staying away from gluten and dairy for sure. Check out my video, DrRic Tutorial Cold and Flu. Both of these two are kind of old, the cold and flu and the stuffy nose one. But they are in a nutshell what I would do with regards to having these symptoms. If it is just truly allergies, hey, no big deal. If it's allergies, get on a Claritin, a Zyrtec, or an Allegra. All the symptoms should go away. Rinse out your nose, you should be fine. But if you're not fine, again, coming up with a diagnosis of maybe a sinus infection, blasting away with antibiotics might be an option. I don't like antibiotics, don't use them myself, but for people that are high risk, it might be worth it. Remember, whenever you take an antibiotic from anybody, it might be worth it to also get on a probiotic for 30 to 60 days. See DrRic Tutorial, probiotic 1, 2, and 3, I believe. Something like that, just for ideas. Otherwise, hopefully in this season you can stay healthy. Don't forget to subscribe to me.